Good morning, students. So hope you all doing good and staying safe. So today we'll be learning about the water soluble vitamins. So you all know the vitamins are classified into two, that is fat soluble and water soluble. So we'll be learning about the water soluble, and look at this slide. So it's showing something. You just do a research on it and let me know whether it is true or not. So coming to the vitamin, as I said, the water soluble vitamins are again two types. One is B complex and another one is non-B complex. Under B complex we have the vitamin B1, the first vitamin thiamine. The structure of this thiamine is, which is having a pyrimidine ring with the thiazole ring connected by methyl bridge, and it is a sulfur containing vitamin and it is heat labile. Coming to the sources, the plant sources of this vitamin B1 are, the rich sources are aileron layer of your cereals, and the other good sources are unpolished rice, whole wheat, peas, beans, etc. And the animal sources are your liver, meat and eggs. So the recommended dietary allowance, or the RDA for this vitamin, is 1 to 1.5 milligram per day, and it mainly depends on your calorie intake or carbohydrate intake. So 0.5 milligram per 1000 calories. So this is the coenzyme form of your thiamine or the vitamin B1, which is called as thiamine pyrophosphate, that is TPP. So here the pyrophosphates, or the two molecules of phosphates, are added to your thiamine ring or thiamine structure. The biochemical functions of this vitamin B1 or the thiamine is, the TPP is the coenzyme form or active form of your vitamin B1, is the coenzyme for all the below enzymatic reactions. The first one is the pyruvate dehydrogenase complex, where the pyruvate is converted to acetyl CoA and carbon dioxide. Here the coenzyme is your TPP. And the alpha ketoglutarate dehydrogenase complex for the oxidative decarboxylation of alpha ketoglutarate to succinyl CoA, where the alpha ketoglutarate is converted to succinyl CoA in the TCA cycle. There again the TPP acts as a coenzyme. Coming to the hexose monophosphate shunt pathway or HMP pathway, here the trans ketolase is an enzyme which require TPP for its action. And then branched chain keto acid dehydrogenase complex, so there also we need TPP. The TPP, it's TPP not TTP, sorry. TPP helps in nerve conduction by acting chloride channels. So this is how the thiamine helps in nerve conduction. Okay, so these are the biochemical functions. It mainly require in the carbohydrate metabolism. Okay, so the deficiency manifestations of thiamine. So it mainly causes beriberi. Deficiency of thiamine leads to condition or a disease called as beriberi. The causes for the deficiency, one is the decreased intake or in the chronic alcoholism or an increased demand like pregnancy and old age, and if we eat raw fish. So these are the deficiency causes of your beriberi or thiamine deficiency. So we have types of beriberi. One is wet beriberi, dry beriberi and infantile beri-beri. Another one is called as cerebral beriberi. So these are the main three types of beriberi. So the general symptoms of your beriberi or thiamine deficiency are anorexia, weakness, constipation, and the subject usually feels weak and get exhausted easily. Coming to the wet beriberi. So here you mainly see the cardiovascular manifestations and these cardiovascular manifestations will be prominent. Those are pitting edema of your legs, face, trunk and other serous cavities, and there will be palpitation, breathlessness, tachycardia and distended neck veins will be seen. Death occurs due to the heart failure. So these are the clinical manifestations of your wet beriberi. So we have three types. One is wet beriberi, dry beriberi, another one is infantile beriberi. The other one is cerebral beriberi. Coming to the dry beriberi, here you see mainly the CNS manifestations, that is central nervous system. Okay, manifestations. So here there will be no edema, you don't see any edema here, and here the walking becomes difficult, and there will be a progressive muscle wasting and there is a weight loss. So peripheral neuritis with sensory disturbances may leads to complete paralysis, and there will be chronic infections in the dry beriberi. So here you can see the picture where there is difficult in walking and there is a muscle wasting and weight loss in the patient. Coming to the infantile beriberi, it mainly seen in the first 6 months of the baby, and here it is due to the deficiency of thiamine in mother, and breast milk deficient in B1 leads to infantile beriberi. So here the symptoms are the restlessness, sleeplessness, cyanosis, tachycardia, labored breathing and heart failure leads to death. So these are the symptoms or clinical manifestations of your infantile beriberi. So coming to the another one which is called as cerebral beriberi, or it is mainly called as Wernicke-korsakoff syndrome or Wernicke's encephalopathy. So it is mainly seen in chronic alcoholics. So because this alcohol inhibits the thiamine absorption, so if it is untreated, Korsakoff's psychosis, coma and death occurs. So this condition is known as cerebral beriberi. As I said, it is called as cerebral beriberi. The symptoms mainly the peripheral and both central neurological defects you can see. So severe memory loss will be there, nystagmus, that is paralysis of eye movement, cerebral ataxia, abnormal gait, mental confusion, psychosis and depression. So these are the the deficiency manifestations of your thiamine or vitamin B1. So coming to vitamin B2. So vitamin B2, it is riboflavin or riboflavin. So the sources and the recommended dietary allowance. The plant sources are your cereals, the good sources are your milk, dairy products and your legumes. The animal sources are lean meat, fish, egg, and the coenzyme forms the FMN and FADs. The recommended dietary allowance, that is the RDA. On sedentary work, they require 1.5 milligram per day, and during pregnancy, lactation and old age, additional 0.2 to 0.4 milligram per day will be given. Coming to the biochemical functions. So it mainly involves in the oxidation reactions and in the electron transport chain. So the coenzyme forms of this vitamin are the flavin mononucleotide, that is FMN in the intestinal cells, and FAD, that is flavin adenine dinucleotide in the liver cells. So these are the two coenzyme forms of your riboflavin or riboflavin, that is vitamin B2. So these are the different enzymes require FMN or FAD as a coenzyme. One is the alpha amino acid oxidase, xanthine oxidase, mitochondrial glycerol 3-phosphate dehydrogenase, succinate dehydrogenase, acyl-CoA dehydrogenase, NADH dehydrogenase, pyruvate dehydrogenase, and alpha ketoglutarate dehydrogenase. These are the enzymes which require FMN and or FAD as a coenzyme. So coming to the deficiency. So the riboflavin deficiency is uncommon because it will be synthesized in our intestine by the intestinal flora. If it occurs, usually accompanies with the other diseases or vitamin deficiency diseases such as Beri-Beri, pellagra, and kwashiorkor. The manifestations are mainly confined to skin and mucous membrane. So the manifestations are glossitis, which is where you see magenta colored tongue, chelosis, that is fissuring of the lips, angular stomatitis, that is inflammation at the corners of the mouth, and circumcorneal vascularization, that is reddening of eyes, and seborrheic dermatitis, that is inflammation of the skin. So these are the manifestations of the vitamin B2 deficiency, that is riboflavin deficiency. So here you can see the picture is showing the first one, glossitis, chelosis, the chelosis where the fissuring of the lips, and seborrheic dermatitis, that is skin manifestation, angular stomatitis, that is the corners of your mouth. So these are the deficiency manifestations of your vitamin B2. Coming to vitamin B3, that is your niacin. So the sources and RDA, plant sources are your dried yeast, whole cereals, peanut, legumes and pulses. Animal sources are liver, fish, eggs, as niacin, nicotinamide and tryptophan. So from animal source we get niacin, nicotinamide and tryptophan. RDA, that is recommended dietary allowance, is 20 mg per day. During pregnancy and lactation, additional 5 mg will be given, and the 60 mg of tryptophan will give 1 mg of niacin. So from tryptophan we can, or our body can synthesize niacin. Coming to the biochemical functions, so it mainly involves in the oxidation reduction reactions and in the electron transport chain. So the coenzyme forms are your NAD, that is nicotinamide adenine dinucleotide, and NADP, nicotinamide adenine dinucleotide phosphate. So these are the two coenzyme forms of your niacin. The active forms are coenzyme forms of your vitamin B3 or niacin. Some of the examples I have given here for the oxidation reduction reaction enzymes. So the enzymes which require NAD or NADP as a coenzymes are: the first one, pyruvate dehydrogenase complex, the alpha ketoglutarate dehydrogenase complex, where NAD is the coenzyme for these enzymes, branched chain alpha keto acid dehydrogenase, and isocitrate dehydrogenase, alcohol dehydrogenase, glyceraldehyde 3-phosphate dehydrogenase are the different enzymes which are dependent on your NAD. Coming to the deficiency of your niacin leads to disease called as pellagra. So the causes of deficiency, the people whose staple diet is maize and also sorghum, and decreased synthesis, drugs like INH, that is isoniazid, which is an anti-tuberculosis drug, Hartnup disease, carcinoid syndrome, and decreased intake and malabsorption are the causes for the deficiency of niacin, which leads to pellagra, or which is called pellagra. The pellagra symptoms are, that is 4Ds. 4D means the first D stands for dermatitis, second for diarrhea, and third dementia. If it is chronic and untreated, leads to death, and the death may be very rare. The first D is dermatitis. It is mainly in early stages. There you see bright red erythema occurs in feet, ankles and face. Increased pigmentation around the neck you see as like a necklace, so it is called as Kessel's necklace. And secondly, the diarrhea may be mild or severe diarrhea with blood and mucus in stools. And thirdly, that is dementia, frequently seen in chronic cases. There you can see irritability, inability to concentrate and poor memory. If it is untreated and chronic, leads to death, and it's rare. So these are the manifestations the picture is showing. Here you can see around the neck, which is the appearance of necklace, so that is why it is called as Kessel's necklace. And the other manifestations, skin manifestations. So this is again same picture. So coming to the vitamin B6, that is pyridoxine. So coming to the chemistry, it is a pyridine derivative. We have three forms of pyridine derivatives: pyridoxine, pyridoxal, pyridoxamine. These are the three forms of your vitamin B6. Coming to the sources and RDA, the plant sources, in that rich sources are yeast, wheat germs, cereals, legumes, pulses, oil seeds and green leafy vegetables are the rich sources of your B6. Animal sources are egg yolk, milk, meat and fish. Coming to recommended dietary allowance, it is mainly related to the protein intake and not depending on the calorie intake. It is in adults 1 to 2 milligram per day, and during pregnancy and lactation it may be increased to 2.5 milligram per day. Coming to its biochemical functions, the active form or the coenzyme form of your pyridoxine or pyridoxine is pyridoxal phosphate, that is PLP, that is TPP, thiamine pyrophosphate, that is thiamine active form. Here it is pyridoxine active form is PLP, that is pyridoxal phosphate. The PLP acts as a coenzyme form for many reactions mainly in the amino acid metabolism. The first reaction, that is transamination reactions, catalyzed by the transaminases. Example, your AST and ALT, aspartate transaminase and alanine transaminase are the transaminases which are dependent on PLP, that is your pyridoxal phosphate. And in the decarboxylation reactions of the amino acid heme synthesis, the ALA synthase, alpha linolenic acid, amino linolenic acid is the alpha amino linolenic acid is the compound synthesized by the enzyme ALA synthase in the heme synthesis pathway, which require PLP. And for the production of niacin from tryptophan, the enzyme kynureninase again depends on the PLP, and it is also required for glycogenolysis, the enzyme phosphorylase, and it is required for the synthesis of your sphingolipids. So these are the biochemical functions of your pyridoxine or the coenzyme form PLP. Coming to the deficiency manifestations. The deficiency manifestations are, one is neurological manifestations where you can see convulsions, demyelination of nerves and leads to consequent peripheral neuritis. Dermatological manifestations manifested as your pellagra, and hematological manifestations where you can see hyperchromic microcytic anemia because the PLP is required for the heme synthesis. So by this we be finishing the 4 water soluble vitamins, that is thiamine, riboflavin, niacin and vitamin B6. The other water soluble vitamins we'll see in the next class. Thanks for your patience.